combining modern medicine with old-fashioned care. River's Edge Veterinary Hospital.
Good morning and welcome to River's Edge Veterinary Hospital. Today we're going to be discussing dental disease, and Lily here has got some dental disease, and we're going to do an exam and then put her under anesthesia and get her teeth cleaned. What we're seeing here on Penny is a lot of tartar and some gingivitis. Can you see that? See how red her gums are back here? This is a big powerful tooth that they use to bite with, and those are often ones that are most affected. We know that 85% of dogs and cats, by the time they're 3, have dental disease. It's actually the most prevalent disease of our pets, and much more I shouldn't say more relevant, but much more common than heart disease, heartworms, intestinal parasites. 85%. That's a lot of dogs and cats that have these dental disease. And the thing about dogs and cats is they can't tell us if their mouth hurts. When we have a cavity, we know it hurts. We call the dentist. I had a tooth root abscess about 8 years ago, and my jaw wasn't swollen. I kept eating. I kept going to work. I kept living my life, but I had the ability to pick up the phone and call the dentist and get that tooth taken care of. And so a lot of times people think, well, they're still eating, their mouth doesn't hurt. That's just simply not true. So it's very important that you come in annually. We'll do a thorough oral exam, and if your dog's teeth have a lot of tartar and gingivitis like Lily here, we're going to recommend that they go under anesthesia, and we'll get them cleaned up, take some x-rays, make sure that there aren't any abscesses under the gum line that we can't see that's causing them pain. So we make a policy at River's Edge that all of our anesthetized patients have an IV catheter in them. It's just an added security measure. If something were to go wrong under anesthesia, we have immediate access to the bloodstream, so we can administer emergency rescue drugs if necessary. That doesn't happen very often, and we do everything we can to keep that from happening. But that IV catheter is an important part of our anesthetic protocol. This water blanket, she's got a heating pad underneath her and a heating pad on top of her to keep her from getting cold. Very important. This is our x-ray sensor, and it's digital. So this little plate, I'm going to put in her mouth, and it will pick up the x-rays. So put this in her mouth like this. Let's just do it this way for now. So I've got this positioned over her incisors, and we're going to take an x-ray, and it'll show up there on that screen when we're finished.
Ready?
Yep. So we can really see that Lily's got a lot of gingivitis. See how red her and bleeding her gums are becoming just by me running this little probe there. But we're running this over there to feel for any pockets. Dogs don't get cavities very often, but it can happen. So we're probing these for any deep pockets that we can't see with our naked eye. I'm going to do the inside of the other teeth on the other side. So after we done probing her teeth, the next step, and this machine may look somewhat familiar to you. It's very similar to what they have in at your human dentist. This is a scaler. If you have to sedation dentistry, a lot of times I use these ultrasonic scalers if you're a little bit asleep, but this helps pull that tartar right off of there. And then so this is the polisher. I'm going to put a little bit of polish in this little cup here, just like they do at your dentist. And polish your teeth. So put a little fluoride foam on here. Rub that on the teeth and let that sit. And that concludes our dental. Dental disease is the most prevalent disease in our pets. 85% of dogs and cats by the time they're 3 years old have dental disease, and sometimes that can lead to a painful mouth. It can also lead to heart disease, liver disease, kidney disease, because that bacteria in the mouth are constantly bathing the bloodstream with bacteria that the body has to continually fight off. So a healthy mouth really leads to healthy pets. When we send Lily home with her owner, we're going to send her home with some home care products so that she can continue to take care of her teeth at home. That's also very important, and something to talk to your veterinarian about what's the best choice in home care, whether that's brushing, water additive, a daily chew, whatever works for you and works for the pet. Thank you for joining us today, and we'll see you next time.
Combining modern medicine with old-fashioned care. Riverside.